on silent, please.
Everyone right to go? Thanks for joining us this morning. There are 25 new locally acquired cases of coronavirus in Victoria. 21 of those cases are linked to known outbreaks. 12 of those, only 12 of those, have been in isolation throughout their infectious period. There were 32,280 test results received overnight, and I thank each and every one of those more than 32,000 Victorians who went and got tested yesterday. That's such an important part of our fight against this virus. It's such an important part in our steady steps towards reopening and getting control of this once again. There were 23,076 Victorians who were vaccinated yesterday through our state-run clinics. That's a significant number, right up there with our best performing days. One of our biggest days on record, and certainly the biggest for a Saturday since the vaccination program in our state centres began. As all Victorians know, I think we are leading the way in terms of the number of state sites and the number of jabs that have been administered through our state clinics, and we thank all of those nurses and others who are doing that really important work. That's how we will get to 70% and 80% as fast as possible. Of course, supply remains the biggest limiting factor, but the additional appointments that we announced on Friday and the target of 1 million doses over the next 5 weeks, I'm really pleased today to be able to announce that there'll be a further 84,000 appointments added to the website today and into tomorrow. So you can go online today, tomorrow, and book with certainty. So that's the best part of 300,000 additional appointments. That'll be available as part of our 5-week 1 million jabs in 1 million arms campaign. There are 1 million reasons to get vaccinated. They're all very personal, they're all very different. But from someone standing at this podium, it's all about getting us opened up again and keeping us open. It's about a different set of rules. It's about resuming our economic recovery that is the envy of so many other parts of the nation, with strong growth and many, many jobs created. It's also about preventing people being admitted to hospital, being gravely ill. And of course, it's about preventing people from dying. Now, these announcements, this additional 84,000 appointments, does not relate to the announcements that the Prime Minister has made today, where there is pleasingly some additional Pfizer that's become available. That is good news. We always want to see more vaccine rather than less. I'm not entirely certain when that will come to us. I wouldn't advise anyone to change their plans based on that. Book with confidence based on what we announced last Friday, based on what I'm announcing today, which is another 84,000 appointments. They're a mixture of AstraZeneca and Pfizer. If you book at a state clinic, you come along, you'll speak to an experienced health professional, they'll have a conversation with you about whether AstraZeneca works for you, whether it's safe for you, and you can then make informed consent. The Chief Health Officer is not here today, but if I can quote him yet again, the best vaccine is the one you can get today. No one should delay on the basis that there's more coming. Yes, there is more coming. When that occurs, who knows? That can be highly variable, and the more people that are protected faster, then the greater the benefit to all of us. That's why getting vaccinated as soon as possible, and particularly knowing that there are these extra appointments available, is so important. That's why we want to get 1 million, if not more, jabs into arms over the next 5 weeks. Now, I just want to make a couple of comments in relation to where we find ourselves at the moment. There's far too many cases there are far too many cases, firstly. Then there are many cases that are not linked. Now, they invariably become linked over time because we do all that coronavirus detective work and we interview and re-interview and we sort of find those missing pieces. But there are a number of mystery cases, and those numbers continue to grow. And that's really challenging. If we were to reopen the whole economy, if we were to reopen and let people move freely right now, then we would finish up where Sydney's at. Thousands of cases, not cases in the 10s and 20s, but thousands of cases, and hundreds of people in hospital, and many of them, very, very unwell. We would finish up with deaths. If there was another way, then we would choose that alternative. There isn't. We have to continue to be vigilant. And I know this is getting really hard. It's getting really frustrating. It's getting really difficult. But I just say to people, look, a sneaky and illegal visit to regional Victoria, it's just not worth it. It's not worth potentially spreading this virus. A pub crawl, an impromptu or pre-planned. Victoria Police are having a close look at that, and I'll let them update you later on today. But a pub crawl, and that's what it was in Richmond last night, is not worth it. It's just not worth it. None of us should be doing anything that potentially spreads this virus, because this virus is not something anyone wants to get. We're not talking about people in their 90s, that's tragic enough. But we're talking about people dying in their 30s and 40s and 50s. This will go where the vaccine isn't. This will mean more and more people are in intensive care. For yourself, for your family, for people you know, for people you'll never meet, for our health professionals who'll have to care for people because of your selfish decisions. Please, I appeal to every Victorian. Please do what the vast majority are doing. Following the rules, doing the right thing, and every day taking us a day closer to being to the other side of this. I know it's difficult. I know it's difficult. But so too is being on a machine to breathe. So too is having to nurse someone in full PPE upon PPE, hour after hour, shift after shift. I've had some of the conversations with family members who've lost a loved one. I've had conversations with nurses who've nursed them. This is not something that you can cheat your way out of, sneak your way out of. I think that Victorians can be very, very proud of everything that we've achieved. I think the vast majority of Victorians are absolutely doing the right thing, but I think there are some people who think these rules don't apply to them, and I just say the consequences are very, very significant and very serious. And I would appeal to every single Victorian, take these rules seriously. They are there for the best of reasons. Are they fun? No. Are they where we'd like to be? No. But we can't control what's going on in Sydney. We can't control the fact that this virus has come here, despite our best efforts to keep it out. But what we can control through our own decisions is how many people get this virus, how many people finish up in hospital, how many people finish up on a machine to breathe, and how quickly we get back open again. That's what we can control if we all just follow these rules. I'm so proud and grateful to the vast majority of Victorians who are doing the right thing. I don't want to move the focus away from them. But there is a sense, I think, out there, and you can see it a little bit, and the data tells us a little story as well about this, that maybe some people think these rules are optional. I know it's very difficult. I know it's hard. I know no one's enjoying this. But we can't pretend this is over because we desperately want it to be. We just can't. The only thing that will flourish are case numbers if we think that we can sidestep these rules, that we can do things that we want to do. That's not where we're at. These numbers are quite concerning. We want to see these numbers come down, and I think that we are seeing these numbers grow and much greater risk of those mystery cases seeding further if people continue to not follow the rules. Again, I'm not for a moment wanting to take away from those who are doing the right thing, and that is the vast majority, and we're proud of you and grateful to you. But there are some people who I think are just through a sense of fatigue and perhaps beyond that, a sense that these rules don't apply to them. Well, they do. Young, fit, healthy people are just as much at risk as anybody else. This doesn't discriminate. The rules don't discriminate. They're important. They're there for everybody. And I just appeal to people. We've done this before. We can do it again. We absolutely can. We can drive these cases down to very low numbers, have them all contained, and then be able to open up again. Just on New South Wales, you know, we send our best wishes to the people of New South Wales. We know what a statewide lockdown is like. We know what hundreds of cases is like. We know what it's like to have many, many people in hospital, and sadly to see people lose their life to this virus. They've been given additional vaccines today. I know some Victorians will ask the question, well, why are they getting more vaccines than we are? Well, nothing else they're doing is working. Nothing else has worked. They've got to vaccinate their way out of this now. We don't want to get to that point, because the flip side of that is hundreds of people in hospital and people dying. We don't want that. We've got a chance to do what we've done before, and that is drive these case numbers down and get the place open up again. But I just again appeal to every single Victorian, please follow these rules, please play your part, please make decisions that you can be proud of, not decisions that you will want to hide from. There's no hiding from this virus. There's no cheating your way around it. There's no breaking your rules. There's no breaking rules or breaking rules, you know, to the point where you turn that into some sort of a successful strategy. It doesn't work. It just does not work. To all those who are doing the right thing, thank you. That is the overwhelming majority. But sadly, we're as strong as our weakest point when it comes to this virus, and that's why everyone needs to do the right thing. There'll be time to go on pub crawls. There'll be time to do all sorts of things we'd like to be doing, and that's when we get to 80% of the community vaccinated. What I'm trying to achieve is that we can be open for some of the time between now and getting to 80%, not locked down like New South Wales are going to be for months and months and months. It's on every single Victorian to play their part, and thank you to all of those who are. I'll now ask Jerome to speak to the numbers here, and then we can take any questions you have.
Premier, good morning. 25 new cases today. That brings to 185 the number of active coronavirus cases here in Victoria. We have 4 Victorians in hospital, one of whom is in ICU, and of course we send our very best wishes to everybody who's recovering from coronavirus in our state. We now have over 500 exposure sites and over 13,000 primary close contacts who are out there isolating for their 14-day period in a far harder lockdown than the rest of us are in Melbourne at the moment. In terms of the 25 cases we have at the moment, 10 of those are associated with household members from Altaqua College. Particularly 2 families, one family of 6 and one family of 3, all with positive cases in their household, and one further household member of a student. And it highlights how aggressive this virus is when it gets into your community. When it gets into your household, the attack rate of this virus is exceptionally high. We also have 7 positive cases today associated with the Glenroy West Primary School cluster. Again, 6 students from the school and 1 household member. That takes us to 17. And there are 3 cases associated with the Caroline Springs Shopping Centre, Caroline Springs Square Shopping Centre, 3 household members, 2 associated with the Jolly Miller Cafe and 1 with the YPA estate agency. That takes us to 20. We've then got 5 cases that are essentially mystery cases or unlinked cases. One of them is a social contact of the Middle Park case we identified on Friday. So we have linked those 2 cases together. But we do not know the acquisition yet of that Middle Park case. The second mystery case today is a cleaner who lives in the city of Greater Dandenong. It's a commercial cleaner who has worked on Fitzroy Street. We believe there's a connection there with the case from Middle Park. So there may be a connection between these 3 cases, but as yet we haven't concluded that linkage. But it is a case who now resides in Greater Dandenong and has a number of other exposure sites. And then we also have a case who's a construction worker or construction services worker who lives in West Footscray. And again, no other linkages yet to any known positive cases. Finally, we have 2 cases from St Kilda East, a mother and her adult son. We've had significant community engagement around these 2 cases last night and again this morning. And my thanks to the entire community in that part of our city for coming together to work through some potential significant exposure sites and community contacts. We'll be working through that over the coming hours and days. That takes us to 25 cases for today. 12 of those cases are isolating, particularly those associated with Altaqua College and Caroline Springs. There were 1 or 2 of those cases who had longer. We've taken a very cautious approach around the potential exposure period that predates the start of their isolation. But on the whole, the isolation protocols have been exceptionally effective for both the school and for those involved with Caroline Springs. And my thanks to everybody who's been doing the hard yards of isolating over the last week or 10 days. This outbreak has moved through a number of different phases already in the 10 days that we've been working on this. We started off with a significant number of community outbreaks and school cases. 68 of our cases so far in this outbreak are associated with that initial set of around 10 schools working through a number of different settings. We saw 4,500 primary close contacts associated with those schools. Almost 90% of those people have already completed their first test. They're now heading into day 13 testing in the coming days. That part of the outbreak's been very controlled. We've seen exceptionally compliance and work with the wider school communities, very strong adherence to the isolation protocols, and my thanks to all those communities for their hard yards they did at the start of this particular outbreak. We then moved into outbreaks like the Newport Footy Club. Again, 1,200 or so primary close contacts associated with Newport Footy Club. Around 8 out of 10 of those already returning negative test results. Again, a fairly well-controlled part of the outbreak. And then into around 3,800 PCCs associated with Caroline Springs and Melton, so moving into those retail settings. Again, 39 cases now associated with Caroline Springs and Melton, over 80% negative test return rate on over 3,500 people. So again, a really strong and well-controlled part of the outbreak. Our concern at this point is that rather than the outbreak now running out, as we saw with the previous outbreaks we've been dealing with, we're now seeing more exposures coming up and more clusters being initiated, and the Premier has spoken to this. So we now have 28 positive cases associated with the Glenroy West cluster, again over a fairly significant geography. A lot more work to do. Over 500 primary close contacts at the moment. 2/3 of those have returned a negative test result already. We have a cluster of activity now around St Kilda East. 2 positive cases identified yesterday afternoon. A lot of work ahead of us over the coming days to try and work out all those potential social contacts and to get them tested and supported. There is additional testing facilities being set up today at Caulfield Hospital and some other sites, and we'll advise as we carry on with that work. We have a lot of work to do around the Middle Park case and a number of potential links, so 2 cases likely to be linked to that Middle Park case, a number of exposure sites in the southern part of our city around that. And then we have some other unlinked cases, the West Footscray construction worker I referred to earlier, as well as some distribution workers identified in earlier days. So we still have a number of loose ends and mystery cases where we're not yet clear about the source of acquisition. The genomics that we have is telling us that they're all connected, so we know there's movement around. And what we're really seeing is that this outbreak is now not just concentrated to the western suburbs. And my call out today is, if you're living in Melbourne, you are potentially at risk from this virus and where it's spreading to. This is not just a western suburbs issue. We have positive cases living in Frankston, living in Dandenong, living across our eastern suburbs, St Kilda, Middle Park, City of Melbourne, as well as across our northern and western suburbs. So please do not think that this is something that's impacting only other people in other communities. This is something that is now touching us all somewhere in Melbourne. And in particular, what we're seeing is the virus is taking a lift on some of these cases we've seen with essential workers. And those of us who are essential workers have not only an opportunity to keep working, and that is not only a privilege, but it's also a responsibility. It is so important. If you're an essential worker continuing to travel through our city at this point in time, you must be on top of your symptoms. As soon as you see any symptoms whatsoever, as soon as you come within a hair's breadth of any of these exposure sites, you must get tested at the first opportunity. We're seeing children gathering, we're seeing schoolwork clubs, we're seeing sleepovers. If those things are happening to your children, if your children have been contacting each other or been with other kids over the recent days, you must go and get them tested today. We have seen positive cases coming out of this outbreak from that kind of contact. If you're supposed to be working from home because you can and you're choosing to work from an office, we'd like you to go and get tested. Because again, we've seen people who are not abiding by the work from home directive who are picking up coronavirus and spreading it into their community. So please, and of course we always see those understandable but so very dangerous household gatherings, household visits, popping over just to see somebody to make sure they're okay, all understandable but also dangerous because we're seeing the virus hitch along and move from one outcluster to another. So please, if any of those scenarios are applying to you, if you've got any reason to be concerned whatsoever, if you've got any symptoms whatsoever, I know it's a nice day out there, we need you to go and get tested today. We are not, frankly, seeing enough activity in our testing centres at this point in time, given the number of different strands we're picking up every single day. So my thanks again to everybody who is doing the hard yards, whether you're in isolation, whether you're adhering to the requirements of the lockdown, whether you're going out and getting tested. We're so grateful for everything that you're doing. We need all of us to do our part over these critical few days ahead. I'll hand back to the Premier for questions.
So just to be clear, this is not about admonishing people or blame. We can't change what happened yesterday. We can only make the best choices today and as we go forward. So we thank all of those, and it is the vast majority of people who are doing the right thing, and we just appeal to those who perhaps haven't been. And look, you might rationalise it and say, oh, I'm only going to go and visit a mate for a short period of time, or I'm only going to sneak over here for a short period of time. None of that's relevant. None of that is relevant. The last thing you want to do is to have contributed to the spread of this virus. That's not good for you, your family, any family. In fact, it's bad for every family. So congratulations and thank you to those who are doing the right thing, and a really clear message to those who haven't been. You've got to make better choices for all of us so that we can get to the other side of this and have days where the case numbers come down and there are less mysteries, less unanswered questions, so that we can be open again and not be like, sadly, our friends in New South Wales who are locked in until they get 80% of people through the vaccination program. We don't want that here. We can do different. We can do a different thing here. But I can't do it on my own. Jerome can't do it. Victoria Police can't do it. Our nurses and ambos and doctors can't do it. Every Victorian has to play a part in that. Happy to take any questions you have.
Premier, you said you can't change what happened yesterday. You're looking at changing things going forward, though. Are you going to be? You mentioned that police are talking later. Is there going to be more police patrols hanging around these areas?
Police can speak to that later on. There's a significant police presence out there now, and I think anyone who was just deciding that the rules didn't apply to them and they could just do whatever they wanted, that'd be a pretty stupid choice to make, because there are police out there, and I think everyone who is following the rules, is particularly annoyed at the virus, yes, but they're even more annoyed at people who aren't doing as they are, and that is following the rules for the benefit of everybody. So I wouldn't be making those choices, because the chances are that you will get caught. But again, police will perhaps have more to say later today about any specific issues, and my comments are much more general, and I don't want them to take away from the amazing work that so many people are doing. But it is important to call out a key risk. And we're going to continue to see these mystery cases. We're going to continue to see this thing spread unless we make, all of us together, the best choices, and that involves following the rules, and not just in their spirit and their intent, beyond that even, being a bit conservative. Do I really need to go shopping for that today, or can I in fact wait till tomorrow?
Are any of our mystery cases or new infections today a result of people doing the wrong thing though?
Oh, look, I think you can go one layer back and say that this virus is out there in the community as it is now, because a number of people have made choices that, I'm sure if they had their time again, they probably wouldn't go and visit family. They probably wouldn't make a choice that, oh, well, I'm sick of this, it's gone on for 18 months. They wouldn't do it. If they had their time again, they would make different choices. But you don't get a do-over. You don't get a chance to do that. We've just got to make really good choices from now on, and I appeal to people to follow the lead of the vast majority of Victorians. And I know it's hard, and we're all human, and you can forget to put a mask on, you can all sorts of things like that. That's not so much what I'm talking about. I'm talking about where people make a very deliberate choice to go to someone else's house or to gather, not to go to the park for exercise, but to go to the park to meet up with 4 other families. Like that's not within the rules. And for a good reason. And it's not because we enjoy putting rules on. What we all enjoy is being open. And the only way to get to that is if we move through this difficult period with a sense of determination, prove as stubborn as this Delta variant. It doesn't go away, and we can't either. We can't allow this to, feed off a sense of complacency and fatigue. I know no one's enjoying this. But what's worse than this? Well, being locked up till the end of October, or indeed the end of November, because that's how long it may well take to get 80% of people through the vaccination program.
With the 175 extra doses of Pfizer, do you know, I know you said that you still don't know when they're coming on board. Are they both first and second doses? And do you have a bit of a general idea when we might be able to see them? And are they for state-run clinics or for GPs?
They're all very good questions, and part of the absolutely excellent questions, and I don't have answers to any of them. The announcement's only just been made. That's not a criticism, by the way. It's only just been made. We'll get that detail and that clarity over the course of the day, and hopefully tomorrow we'll be able to answer all of those questions. I would just say, always good to get more vaccine. We all wish if there was probably one thing we could change, you'd dream up another couple of million doses and you'd get the community done. Because my sense of it is that there's not some of this hesitancy stuff that we read about and hear about, I don't get that at all. I think there are millions of Victorians who want to get vaccinated, and they want to get vaccinated yesterday. And the response since Friday, tens and tens of thousands of people who've booked, now even more, another 84,000 appointments, taking it to nearly 300,000 additional appointments through state-run clinics over the next 5 weeks. I think they're going to be snapped up really, really quickly. So you can't delay. You can't sort of make a judgment, oh, well, I'll get around to that next month. No, make that proactive choice. Get vaccinated now. As the Chief Health Officer says, the best vaccines are the one you can get today. There's lots available today and tomorrow and for the next 5 weeks. And then, to sort of partially answer one of your questions, Samaya, I think that these may well be first doses, because by the time we've used them up, we'll be starting to see further supplies of Pfizer coming to us, as well as Moderna as well. But I wouldn't, out of this good news today, I would just say to people, don't put off your plans to get vaccinated as part of the 1 million jabs over the next 5 weeks. This is good news, but let's make sure that those 175,000 extras mean that we can do more than 1 million, because we have many more than 1 million that we have to do, of course.
New South Wales is obviously in the most difficult position across
They
the
are.
country, and
Yes.
that's why presumably they're getting half of the 1 million Pfizer doses. Given the situation that we're finding ourselves here in Victoria as well, a lockdown, growing mystery cases, would you have preferred to receive a bit more than 175,000 vaccine doses?
Well, I've just made a few comments about things I can change and things I can't change. I can't change that.
What would you have preferred, though?
The Prime Minister's made his decision. The fact of the matter is the greatest need is in Sydney. I've always been a supporter of those who are in the greatest need getting the greatest amount of support. We could have a long debate about why Sydney's in the position it's in. I'm not going to do that. I'm not going to offer up that sort of commentary. We had plenty of people giving us the benefit of their wisdom, so-called, last year, and Victorians were thoroughly sick of it by the end of last year, so I'm not going to contribute to that. All I'll say is that they have to be given more vaccine in New South Wales, because nothing else they're doing is working. This is where they're at now. They're going to have to vaccinate their way out of this, and we wish them well in doing that. And I'm not for a moment quibbling or in any way being difficult about them getting more than us. They need it more than us, frankly. That's not to say we don't have need, but their need is far greater at the moment, and the only thing that's going to work for them now, there's no way they're going to get to 0 cases. 400 a day, They've gone to a statewide lockdown, that's good. Beyond that, I'll let the Premier of New South Wales defend the decision she's made and not made.
Do you feel confident that if the boot was on the other foot, we would have been given as many allocations as what they have out of this 1 million doses?
You'd always like to think so. We got a lot of commentary from people last year. We got a lot of political attacks. We got a lot of people in different parts of the country lecturing Victorians and laughing at Victorians and enjoying our difficulties a bit more than they probably should have. Let's not return that. Let's not do that. Let's not get into that. That's not smart, and it's wrong, really.
Mark McGowan.
I would hope to answer your question as directly as I can. The strategy at the moment is to try and avoid us ever getting into a situation where we need hundreds of thousands of extra vaccines, because contact tracing and lockdowns and all the other measures we've used have completely failed. We don't want to get to that. We don't want to get to hundreds and hundreds and hundreds of cases a day, because that means hundreds of people in hospital. That's what we're trying to avoid. And it means you're locked, you're shut, you're locked down, you're closed until 80% of people are vaccinated. And then I'll make another point that I think has not been made enough. The Doherty modelling, to ease at 70%, to open at 80%, and to have a very different set of rules. So, for instance, no lockdowns once you get to 80%. That modelling does not assume that there are thousands of cases and hundreds of cases every day. That modelling assumes there is a very low number of cases. So if we want to be open, if we want to have a new set of rules as we go into a new year, if we want to preserve our health system for everybody who needs it, not just COVID patients, but everyone else who has a terrible accident or has a health emergency, then we have to, when we get to 70 and 80, we have to have cases down here, not raging. Otherwise, I'm not sure, I don't know how that works. To be open at 80% vaccination with thousands and thousands of cases. That's not what the Doherty modelled. That's something very, very different. I don't think it's very good, and I'm determined to make sure that it doesn't happen here.
Just on that reopening process, there are countries like Israel that have had very high vaccination rates that have now reopened, but I think they're spending the equivalent of about $1 billion Australian dollars at the moment on increasing their hospital capacities because they're still dealing with a lot of hospitalisations. What is Victoria doing to deal with that almost certain reality that we are going to have to deal with when we open up?
Yeah, it's a very good question. I just would note there's a lot of comparisons with Israel. You know, Israel got to 60% in a short number of weeks, and then in a period that's sort of twice as long as that, they've been stuck in the 60s. I don't think they've got beyond 67 or 68%. So they're certainly less than the 70 and well less than the 80. I'm not criticising them. That's still much better than we've done. But you know, it would seem that last 35% or so are proving very, very stubborn to get them through the program, and maybe there's a whole range of reasons for that. I'm just making the point that the Doherty modelling and our plan means we will exceed the vaccination level that Israel's at now. That's the first point I'm making. On health system preparedness, I'm more than happy to have the Health Minister take you through in some detail what we're doing there. We know that just like it's happening in America, you know, and I referenced Florida and Texas the other day, and people might say, oh, well, that's a long way from here. Why is he talking about that? Well, look, there's a pandemic of the unvaccinated. They've let all their rules off, and now they've literally thousands and thousands of people in hospital. So we will finish up with many people getting this if they don't get vaccinated, and they will get seriously unwell, and they will have to go to hospital. So we're making plans, contingencies for all of that. As far as the details go, I'm more than happy to have Martin and maybe some of the senior health bureaucrats can do a briefing for you guys and through you for the Victorian community. But having spoken to literally dozens and dozens of nurses, particularly nurses from last year, and that wasn't Delta, and it was hundreds of cases in hospital, but it wasn't thousands and thousands. And some of the stories they tell me, yeah, it's very, very challenging.
Just this week, though.
We don't want to go back to that. So that's why you got to open with very few cases and then do everything you can to keep promoting people getting through the vaccination program for them and for everyone, and for the nurse that'll have to treat you, and for his or her family and all of that, right? For all the best of reasons. But even, I can tell you from our experience last year, I'm sure if I were to speak to nurses in New South Wales, what they're dealing with now, they'd be telling you exactly the same stories. It is incredibly difficult, and we have to do everything we can as a government, but also as a Victorian community, to not be putting our health professionals in those difficult circumstances.
Just this week, though, with under 200 cases in the state, only a handful of cases hospitalised, we've seen ramping at 2 hospitals. You're going to have to do something pretty drastic to get our hospital system ready for what it's going to have to deal with when we reopen, aren't you?
No, I don't disagree with that at all. I don't disagree with that at all, but I don't know that we've necessarily got an hour to go through it all today, but I'm happy to get Martin to sit down with you, and maybe offline with you and a few other people. They can take you through all the stuff that we've done. I would just say, in relation to ramping an ambulance, Queensland, WA, Northern Territory, everywhere, right? Across the board, everywhere is dealing with what they're calling deferred care. Big demand, perhaps demand that wasn't met last year because people made a choice not to present. People that are unwell because of last year. You know, there's no one for a moment, and I see some of the commentary from Pat McGorry, you know, no one for a moment is doubting that there's a significant toll that comes from this global pandemic. And, you know, if I had a different lever to pull, a different tool to use, a different choice to make, then we wouldn't be locked down. We'd be open, and we'd use that other magic thing that isn't there. It just isn't there. And the choice is not between open and closed or normal and this. The choice really is between where we are now and hundreds and then thousands of cases, and hundreds and then thousands of people in hospital. And people at home, oh, that's all a bit dramatic. No, it's not. It's just what will happen, and it's what's happening in New South Wales now. And we send them our best wishes. And if we hadn't had cases come from New South Wales and have our own challenges now, we'd be helping them out. We'd be taking ICU patients. We'd be doing all sorts of things to help. Sadly, we can't do that because we're dealing with our own challenges.
Just quickly
people
back on
listening-
vaccination, Mark
Yep.
McGowan said this morning that he supports expanding mandatory vaccination into industries such as ports and mining. Do you have a position on that?
Well, look, we are already making vaccination mandatory in a number of high-risk settings like aged care. Disability may well follow in that vein. I think that there will be a case to be made, particularly in very high-risk environments. And when I say high risk, it's not just the people you work with, like aged care, for instance, and the vulnerability of those people, but it's about your potential to contribute to the transmission of this virus. So working at a port, whether it be an airport or a seaport, as is the case, I think probably more relevantly for WA, mining, simply because of the sheer size of the workforce, and FIFO moving to all parts of the country. There'll be different examples where it is appropriate for everybody to have had the jab because that's the best protection. You could I think make the same arguments for supermarket distribution centres from a food security point of view, meatworks, list goes on and on. I think the best thing is to try and encourage people to do that first. But if you encounter a problem, then there are health orders, and they can be made both by the Commonwealth through the biosecurity framework or by the states through the public health framework to make sure that everybody who needs to be vaccinated is. Hopefully this is a moot point because everyone understands and realises that the best decision is to get vaccinated. These vaccines have been through the world's most vigorous process. They are our way through this, and they are also the way to avoid becoming gravely ill or someone you love becoming gravely ill. Surely that's a better outcome.
People listening to your language today about our new cases, our mystery cases, the slightly lagging testing rate, would potentially be thinking, we're not getting out of lockdown Thursday, this isn't sounding good. Is that fair to describe our position at the moment?
No, I've always tried to be as frank as possible, whether it's from this podium or in any of the the work that I do. I'm not here to do anything other than be frank. And these numbers are too high. There are too many questions that are unanswered as part of these cases. There are too many people who are making poor choices and doing their own thing and thinking that the rules don't apply to them, and that takes away from the vast majority of people, the many millions of people who are doing the right thing, and I thank them again. But let's draw a line. You might have been out doing the wrong thing yesterday, but from now on you just can't. You've got to make better choices for today and all through this week and next week and until this thing's over. I'm not announcing Thursday's announcements today. Today's Sunday, and I don't know what our position will be on Thursday, but these are not good signs, and that's why we all need to work together and we all need to follow these rules because it's our way out. And look, the thing is, it's not some theory. Like, we've done this before. We are equal to this task. In fact, we're better than it. We're better than the challenge we face. We're stronger than the challenge we face. We've demonstrated that like no other Aussies, and we can do it again. I think we're running alongside this virus at the moment, but we've got to get out in front of it. That's when we'll start to see numbers reduce. That's when there won't be the mystery cases. And the best contribution that people at home listening to this, not asking you to do the contact tracing or to be doing the job that I do, what I'm asking you to do is follow the rules. And if you do, you'll be making a massive contribution. Get tested if you've got symptoms. Get tested if you've got symptoms, and don't wait an hour. Go and do it today. It'll make a big difference, a really, really big difference, just as it has in the past.
To quote Jerome, yes, 24 hours in a pandemic is a very long time. 7 days is an eternity. But realistically speaking,
Yes,
how long
that's-
do you think we might be in this situation in terms of being locked down? I do listen and pay attention, Jerome.
Just making sure Jerome was paying attention by quoting him. Is that what you were doing?
How long?
7 days is, look, 7 hours is an eternity in this thing.
Realistically, how long do you think we might remain locked down, just given the situation that we find ourselves?
As I just said before, I'm not here to be. I'm here to be clear, right? And I try and be as frank as possible. And sometimes people like that, and sometimes people don't. But I can't tell you what the settings will be at midnight on Thursday night. As soon as I can, I will. It's always been the way. We'll want to look at all the data. Case numbers are not so much the issue, it's the circumstances behind each one. Look, we can have 20 cases in a day, but if we know how they all got it and they've all been tucked away from everybody else and they're no risk to public health, then that's fine. We can deal with that. But when you've got mystery cases, so cases that they don't know who they got it from, so that means there's at least one other case out there for each of those mysteries. And then when you've got just this sense that there are some people out there, not the majority, like it's a small number of people, but it maybe is growing, and we've got to stop that are out there doing the wrong thing, that are out there making choices. They might rationalise, oh, it's innocent, it's easy, I'm only going to see mum, I'm only going to see my mates around the corner, or, you know, I'll stay out for 6 hours instead of 2 hours, and I'll happen to catch up with a whole bunch of people down the park or whatever, or go on a pub crawl. Like, you know, they're the sorts of decisions that make the job of our contact tracers much harder. And it's just an insult to everybody out there who is doing the right thing. Millions and millions of people who are doing the right thing. It's just an insult to them.
What do you say to businesses, though, that have been put in a position like they're trying to do the right thing? They obviously can't open for dine-in service, so they're serving drinks.
Yep.
If people come up in groups of 2, if they're within their 5Ks, if they're out for their walk, how do you propose that they establish who's doing the right thing and who's not? If people are attempting to do the right thing.
Can I say a chain of venues advertising that they would operate as a chain of venues? Yeah, I'd rather not see that. The police can speak to these matters better than me. They're looking at it. They're going to continue to look at it. I don't do the enforcement. I don't issue the fines. But I would prefer if people were not out buying drinks from multiple venues and travelling between multiple venues or whatever has gone on. I don't know that that's necessarily contributing to pulling this thing up. Like, this is in Richmond. There's tier 1 and tier 2 exposure sites in Richmond. There's been cases in Richmond. The notion that you'd be wandering around Richmond. Anyway, back to be positive. We can't change that yesterday. I'll let Victoria Police speak to what they might do about it in the future. To your point about the rules.
Or increase the fines. That's what New South Wales has done. Do we need to up the ante?
Yeah, well, I don't know what impact that's having in New South Wales. What I would say is we have significant fines. We have shown and we've demonstrated, I think, a willingness to issue them. More warnings are issued than fines, and that's the way it should be, because many people can make an innocent mistake, or they can make a mistake once, and if once they're warned, they won't make that mistake again. I just think there are a lot of people who, and again, I'm more focused on decisions people make today and for the future rather than what happened last night. I can't change that. What I would say is that, you know, the rules are there for everyone. They protect everyone because they get us open and they limit cases.
Is there a loophole that they're exploiting, though, that's allowing large crowds to gather outside takeaway?
I'd let Victoria Police speak to that matter. They're going to be out later on today, and they can speak to what investigations they've done, what views they have, and if they come to me and say we need to tighten something up or whatever it might be, then we wouldn't hesitate to do that.
What is it reassurance for a roadmap out for us to be able to start to plan our lives as we start to come out of this outbreak? Are you able to give us a roadmap out? Are you looking to give the public a roadmap out?
I am not able to do more than I'm doing right now, and that is appealing to every Victorian to follow these rules, because that's what will drive case numbers down. This Delta strain is very challenging. We know that. We see that around the world. We see it in Sydney. We don't have to look far to see what happens when this gets away from you. As I said to Rachel, it's not 25 cases. It's 400 cases, 600 cases, 800 cases, whatever the number's going to finish up being. And it's thousands of people that need care. And a goodly number of them will need, like, really significant care. They're not in for an overnight stay. It's not a bump or a bruise. Like, it's significant. It's intensive care. And as I said to you the other day, I never thought I'd be able to stand here and say, having been in intensive care this year, I can tell you it's no fun. But I can, and I am. It's not fun. It is not fun. So everyone needs to take this seriously. That's all we can do. That's our roadmap. Our roadmap is each and every Victorian plays their part by making the best decisions for their family and every family, and we will drive these numbers down. And why do I say that with such confidence? Because we've done it before. We've absolutely done it before, and we can do it again, and we will.
What kind of reassurances can you give to parents, though, particularly those of young children who are, you know, supervising them with remote learning? They've done it every single term almost since last year.
And it's incredibly difficult.
Getting kids back to school, and I know schools have been exposure sites, there's been, you know, serious clusters from there as well, but how are we working to opening schools and allowing them to stay reopened, like rapid antigen testing? Is that something you're considering?
Well, I'm glad you asked about rapid antigen testing. There's been a bit of political stuntery about this. The Prime Minister made the point well at National Cabinet the other day when he said that the fact that the TGA have not approved rapid antigen testing, the fact that this gets thrown around as some kind of a panacea or a golden ticket, some sort of magic wand, is dangerous. That's what the Prime Minister made the point, dangerous. And that's the view of Paul Kelly. That's the view of all sorts of different experts. Rapid antigen testing can work if you do it each day, every day, and in what's called a serial fashion. Not one-offs. They're not as good as a PCR test. No one should be in any doubt. We're accessing the best of technology. We waste no time doing so. But there are some things that are available to us, like rapid antigen testing at the moment is available as part of a trial. It's not available to everyone, and it's certainly not available at home to administer yourself. Why? Because the TGA have not approved it.
Is there anything?
So and this is the thing, how people have time to play these games in the midst of a pandemic is beyond me. I don't have any time to talk about it any more than I just have, but I just thought it was important to clear that up. We'll use whatever we can to keep people safe, and we'll get kids back to school as soon as it's safe to do so. But you just got to think about school for a moment. I know it's incredibly difficult, and our kids are a bit older, and maybe they're a bit more self-reliant. They're not in grade 2 and grade 4, and they're in year 9 and year 11. But, think about school for a moment. That's literally hundreds and hundreds of thousands of students moving back and forth every day. Mums and dads, teachers and staff. It's so much movement. It's hundreds of thousands of movements a day. All that will do when you've got mystery cases out there is spread the virus. And then we'll finish up like other parts of the country, where there's no chance of being open until everybody's vaccinated, and the vaccines aren't here, and everybody being vaccinated is months away.
Just on vaccines, the New South Wales.
That's just the logic of it if you step it out. It's not a very pretty picture, but that's what we're dealing with. And I know that having kids at home is not fun, particularly if you're working from home as well, and all of that. It's very stressful, it's very challenging. But we'll take care of every child, every student. We are I've seen it firsthand from visiting some schools not so long ago. The tutor program that we've put in place, more than 5,000 of these tutors working with kids one-on-one and in small groups to catch everyone up and make sure that everybody's exactly where they would have been if this global event hadn't happened. They're doing a great job. And if they have to work for longer, if they have to be there for longer, then of course they will be.
The New South Wales Premier, she's again indicated that once they get to 50 or 60% vaccination rate, she will ease some restrictions around the edges, particularly for those who've been fully vaccinated. In National Cabinet on Friday, has she given you and your colleagues assurances that she would come to National Cabinet and let you know beforehand about some of the restrictions she's thinking about easing, and will it be a consensus process?
No. What I'd say is that there are agreed steps once you get to 70%, there are agreed steps once you get to 80%. That's that national plan. Everyone has signed up to that national plan, and everybody keeps re-signing up to that national plan every time we meet. Because there is this thing where people go out and do press conferences and say things and maybe lead people to believe they're walking away from the plan when in fact they're not. I don't know why we keep doing this dance. I'm not criticising you for asking the question, but in the room, there's no doubt. Everyone signed up to the plan. I hope I've never said anything that gives anybody an impression that I'm going to go it alone. I'm not. And what I can say is when I hear from every other First Minister, New South Wales included, no one's walking away from the plan. It's 70 and 80. Now that doesn't mean you can't change some rules. Changing some rules is not the same as opening up. I think that's what's being said up there, I think. All I can go on is what's said to me at National Cabinet, and there's no doubt in my mind that every single First Minister, every government is signed up to getting to 70 and then getting to 80 and having the rules commensurate to those two milestones and the framework that National Cabinet has agreed to. Now, I think it is right to say that there might be variability, there might be differences, to Rachel's question before, between states in outcome, not in rules, not in policy, but in outcome. Because if you open at 80% with thousands of cases, it just stands to reason you're going to have more people in hospital than if you open at 80%, as I hope to, with hopefully a very small number of cases. That may mean there are some differences. But no, I've heard nothing from any government across the country other than we're all signed up to this.
And if there are states or territories that open up with, theoretically hundreds of cases, once we reach 80%...
They won't be getting in here.
What would they mean?
They'll be locked out to here. They will absolutely be. Like, we've got a case in Wentworth today, I think, haven't we? And we wish that person well, and hopefully it's, in fact, not a case. Hopefully we get a negative test for that person at some point. But, this got from Sydney to Melbourne to Mildura. This got from Sydney, we got from Bondi to Canterbury, Bankstown to Dubbo. Like, if it can do that, only a fool thinks that it can't get from Sydney to Albury and from Albury to Melbourne again. Like, whether we like it or not, there is movement, freight, all compassionate cases, all sorts of movement. No one enjoys locking Victorians out of Victoria or locking Melburnians into their houses. But the alternative is what's happening in Sydney. And we just don't want that here.
Your works are underway at Melbourne Centre for National Resilience. What would you say to Mickleham residents who still have concerns about this facility being built in their community?
Well, they shouldn't be concerned. They should be far more concerned to think that, I don't want to tell them what to think, right? But this is what I'd say. Mickleham residents and all residents in Victoria, in my judgment, should be far more concerned at the prospect of international travellers, a bunch of whom will have the Delta variant, and worse potentially as we look to the future, being quarantined in hotels that are not built to be quarantine centres. That's a far more dangerous outcome than having a purpose-built quarantine facility in Mickleham with all the appropriate standards, built as part of a complex that already deals with a range of biosecurity issues. It's not like it's a greenfield site. This is exactly what we need. And I would just respectfully say to the people of Mickleham and all communities, there's more to be scared of, there's more to be fearful of, and more to be worried about from having people in hotels than there is from building a purpose-built facility. That's exactly why the Commonwealth and our government are doing that.
Can I ask Jerome some questions?
It is federal land, though, I might say, so our planning scheme doesn't operate there. A point I made yesterday.
Can I just ask some case questions?
Of course you can. Any other questions for me?
Just quickly from you, just talking about earlier with the pub crawl, the new laws are making it easier to take away alcohol, for people to be able to purchase alcohol for takeaway. We've had some family violence groups speak up today saying that they're very concerned about this being able to happen. What's your thoughts on that?
Yeah, look, people are entitled to their views, and we listen to those stakeholders. In fact, all stakeholders, whether it's the people of Mickleham who have concerns or people from the family violence sector, we listen to views right across the community. It's very important. I would just say to you that far from making it easier, there are some changes in our liquor licensing framework and packaged liquor and that whole home delivery framework where harm is now front and centre. So we've properly defined that. There's a process to take that into account. Previously, that's not been part of any of those sorts of decisions. But again, we'll work with those stakeholders. We have, I think, for many, many years, when you think about it, the Royal Commission into Family Violence, the implementation of all of those recos, many billions of dollars that have been provided. We work with that sector, and we're deeply grateful for the work that they do. And if they've got a perspective, if they're seeing something that we aren't, of course we'll sit down and work with them.
Just quickly on mental health before we go to Jerome.
Sure.
Other jurisdictions have had chief...
You've had fair warning now. You better have answers for all of these, righto?
Other jurisdictions have had their chief psychiatrist address the people in the state on the issue of mental health at their press conferences. I think we had Pat McGorry come last year.
We did.
Given increasing concerns about that, is that something you'd consider doing soon?
I'm always happy to have... Rachel, with the greatest respect, I've worked very closely with the mental health sector for decades now, all my time in public life, right back to when I was first elected and was a very junior person over in the health department. Mental health community's never been shy, never been backward to come forward with a view, and it's one of their great strengths. If we can get some further messages out there of support and encouragement, and also details about where you can get help if you need it, always happy to do that. I would just say though, what's as important, and really I think probably more important than words, is action, and there are literally billions of dollars in this year's budget, the biggest boost in Australia's history, in the country's history, including the federal government, and that's all about and today even, very significant progress on a youth mental health facility in Melbourne's north, just one among many hundreds of investments we're making. Training new types of workers and more of the same to meet demand, brand new models of care, much more about keeping people well in the community rather than a crisis-led model where the system almost makes it worse. The Royal Commission into Mental Health, that's an impressive piece of work, but we're not letting it gather dust. We've literally are providing billions and billions of dollars in the very first budget after the final report was handed down. And I do look forward to being here in a non-COVID context and updating you and all of Victoria on many different occasions about all the investments we're making. This is everybody's business. Some people don't support the investments we're making. They're not part of that journey. They're not relevant to our work. We're just pushing on and we're going to get this done. And we don't underestimate that the pandemic has been and is still really challenging from a mental health point of view. But if having more people to come and talk about what we're doing about that here, always happy to arrange that. I'll try and arrange that soon. Now, you've all got a whole series of detailed and intricate questions for Jerome that he's got answers to.
Jerome, can I just start off with, yesterday we had 8 mystery cases.
Yep.
With the way that things are working today, are we counting it as 4 additional on top of that? Do we have answers to any of those 8? Where is our count at today?
No, I think we've got certainly of the cases today. So there are a total of 5 cases today that are not part of our existing major clusters. So St Kilda East is we think is going to be the start of another probably significant body of work. So those 2 cases are connected. The other 3, as I've said, 2 of them are likely to be linked in some way, shape or form to the Middle Park case we identified a few days ago. So we're tracking those through at the moment. So at the moment there are really, there are 8 probably mystery or 8 clusters at the moment that we're really focusing on across this entire outbreak. There are some linkages that we can start to see, others that are still not there to be found. And I think that kind of takes us to the challenging stage of this outbreak. So the previous outbreak we were dealing with, the one that came from the infamous removalist that went through the MCG in Amy Park, at this same stage we were starting to see the numbers start to come down. We had everybody well contained, and then, although we had a large number of primary close contacts and a larger number of cases than we do today, we hit 208, the numbers were starting to trend down because there were no new active clusters being generated. What's of concern today is that we've done, I think, a really good job with the communities around the schools, around the shopping centres out west, around the footy club and a number of those other community groups. Those numbers are pretty stable and they're all contained and they're all isolating. It's the fact that we've now got 3, 4 significant clusters that are being generated that we now have to focus on. And that's the area of concern at the moment. And that's why this is a real tipping point. We can deal with those new clusters. We can deal with St Kilda, we can deal with Middle Park, we can deal with Glenroy. But if there are more cases coming off the back of them, that's where you start to check your tail.
Can you just explain to us a little bit further this St Kilda East case, those 2 cases?
Yep.
Why are they of concern? What's the nature of them?
Look, they're of concern because it's 2 cases that are in one family. So it's a mother and a son. They're not at this point in time connected to any of our other positive cases that we've seen so far. It is part of a close-knit community. We had a number of meetings last night and this morning with leaders of that community, and that will be the key to unlocking this, as it was 10 days ago when we were dealing with Heathdale School, when we were dealing with ICOM, with Altaqua and other schools. It is a strength of those communities that will get the community through and allow us to rapidly contact trace, make sure people are isolating, and make sure people are supported to do the right thing, because it's the behaviours going forward that matter that allow us to roll it up.
So are there apartment buildings in St Kilda that are associated with those 2 cases?
Not at this point. So obviously we've got more work to do. These cases dropped yesterday afternoon. We've got more work to do with them to work out which contacts were being made. There will, I think, be a number of exposure sites we'll be working on. We haven't identified any apartment buildings yet in St Kilda, but again, we'll wait and see what we discover over the coming 24 hours.
Are you investigating an illegal gathering in relation to those 2 cases?
We are making a number of investigations, Rachel, at the moment around those 2 cases and other cases, and we won't stop to find all potential links that have been made.
And how long have they been symptomatic before they got tested, and how long do you think they've been infectious in the community?
I don't know the details with me at the moment, Samay. I think they've been infectious for a number of days in the community, certainly.
Residents of an apartment block in St Kilda on Fitzroy Street were sent an
Yep.
email last night
That's
about
right.
it being a Tier 1 site.
Yep.
It's not listed, there's no support down there. Can you give some clarity?
That's right. So not related to the St Kilda East St Kilda East cases we're dealing with at the moment, but the Middle Park case we talked about a few days ago, the commercial cleaner from Greater Dandenong has worked at an apartment building on Fitzroy Street. We believe that's one of the possible coincidences between the Middle Park case. The residents of that building were contacted last night through the building corporation and through ourselves. We had our people contact them all last night. We will be on site during the course of this morning working with them to both establish some rapid testing on site and to start to do the usual cleaning areas. It is at this point in time we're debating what the level of exposure is. That'll be a work we do over the course of the day.
Can you run us through how many children are infected? We're seeing obviously a lot of numbers around students, but overall in our active cases, what percentage are
I can give you an age breakdown of the whole set. I thought this question might come up. So we've got 44 children under the age of 10 with active cases at this point in time. We've got 39 children aged between the ages of 10 and 19. We've got 65 people between the ages of 20 and 40, 31 between 40 and 60, and 6 over the age of 60. And what that highlights again is why this outbreak's so different. When we were dealing with the MCG and Amy Park outbreak, the dynamics there were very different because we were dealing primarily with people in their 20s, 30s and 40s, and quite an active group, lots of social contacts, lots of clubs and lots of exposure sites that you'll all recall. This outbreak started in school, so we're seeing a far higher number of school children involved, grade 3 students, grade 2 students, becoming positive. We're seeing connections within schools and between families with kids at multiple schools, which is why these numbers have grown so quickly. And again, that's why the conversation earlier with the Premier around, absolutely we all want to get schools back. We can't wait to get our children back into a structured environment. But with these active cases amongst school communities, we have to get these cases out first. We have to get rid of this community transmission before we can go back into that space again.
They're obviously all unvaccinated, those 44 under age 10 in particular. How sick are they? How sick are the kids?
So look, there's no children that are seriously ill at this point in time, to the best of my knowledge. So there's one case, one child that has been hospitalised, but I believe they're stable and they're otherwise reasonably well, but it's the safest place for them to be at this point in time.
And what sort of interaction is it taking for them to actually be passing it on to one another? For example, is it a good idea for parks and playgrounds to still be available to families, given we are seeing that high proportion of kids?
So look, I think again this goes to the whole directions and the really good behaviours we're seeing out there, but also good examples of not great behaviour. Social distancing, we all know through our bitter experience, is critical, and it's even more important with Delta because of the way it transmits so easily. So social distancing still applies when you're outside. Mask wearing still applies when you're outside. So absolutely jamming hundreds of people into a playground on a sunny Sunday morning is not a great thing to do. It's not a great thing to do for you. It's not a great thing to do for your kids. And again, another call out, we are hearing on the grapevine children who are visiting each other's houses, children having sleepovers, people doing their schoolwork together at their homes. It is an incredibly dangerous thing to do. The virus can and has taken a hitch. We've got essentially 83 people under the age of 19 who are positive with COVID. That's almost half the entire outbreak. It's not happening by accident. It's happening because people are getting together.
There was wastewater detected.
Yep.
There was wastewater detected in the Endeavour Hills, Dandenong area last week. Do you think that's related to this particular cleanup?
Yeah, possibly. So as we've said over a number of days now, we see wastewater detects blipping on and off, and we always try to connect them to known positive cases, primary close contacts, people coming back from red zones. We have seen some blips in Endeavour Hills, Greater Dandenong, maybe connected to this case that we've identified today.
You mentioned earlier that cleanup. Sorry, I was just going to say, the cleaner in Dandenong, how many close, she's an essential worker, do you know how many close contacts she may have?
So we're still working with the cleaner at the moment to identify how many close contacts they've got and the premises they've worked at. Certainly the Fitzroy Street apartment that we talked about earlier is one of those locations.
You mentioned earlier that if people were working from the office, if they could work from home, then you wanted them to get tested. Is that a direction or a suggestion?
No, it's a very, very strong suggestion. So the direction is if you can work from home, you need to work from home. Most of us don't enjoy that. Most of us want to be back in an office environment. That is not safe to do, so that is why that direction is there. We're aware in some of the cases we've identified in the last week that people have chosen to or sought to work from the office rather than working from home. They sought to bring people in there with them. It is a dangerous thing to do. It is one example of transmission that we've seen in this outbreak. So if you've been sneaking into the office because that's a calmer, better place to work, if you've been seeing other people in that setting, you need to go and get tested. It is just this whole thing is too delicately poised at this point in time.
Can you shed any further light on where this all started? If we go right back to the Hobson's
Sure.
Bay and the Maribyrnong cases,
Yep.
are we any closer to answers there?
Not really, no. So we've got strong genomic connections across all of the cases we've looked at so far. I don't have the results for yesterday's cases yet, but just about every case before that is genomically connected to this cluster. We're still seeing that and very close connections with the wider New South Wales. The current active cases in New South Wales are still quite closely connected genomically. We know that the original Newport couple that we were working with, the individual who worked at the opticians in Caroline Springs and the teacher Altakwa, are still the earliest presenting cases, and most of these other cases are still downstream. But as I say, we've got 8 different subclusters at the moment, still some linkages we haven't quite nailed down. I can't exclude the possibility that there've still been some new incursions in from New South Wales, but we don't have any more detail than that.
Are you able to say whether it's more likely that the sort of subclusters, if you like, that we're seeing at the moment are connected to either the sort of MCG removalists or the Coolaroo cluster from the previous the previous lockdown, or to new incursions from New South Wales, or a mixture of both?
So we're very clear there is no connection to the removalist Ariel, MCG, Amy Park, Miss Frankie. That is a genomically different strand altogether. So we're not dealing with that, and we've not picked up any cases that have any relationship to that outbreak genomically or epidemiologically. Including the Richmond case, which is the teacher at Glenroy who lives in the Richmond block. So no connections there whatsoever. So we've excluded that from our considerations. There are some close proximities between the Coolaroo cluster that we talked about a few weeks ago, and more recent incursions from New South Wales. They're very closely linked genomically. We're continuing to work both those areas. I think, as we've discussed, as Brett discussed a few days ago, it may be that we never find out the exact source of acquisition for the Newport couple. Bear in mind, it's now going back into very early August, end of July. So it may be that some of those will just get lost in the midst of time. That's a regret. Our focus at the moment is on making sure that everything downstream is being really close together, and we need to establish those links, particularly for Glenroy, for St Kilda East, and for Middle Park. Those 3 links are the ones that we really want to nail down.
So just to be clear then,
can you explain why I understand there was a negative test and after some symptoms in late July. Can you explain why that means her exposure sites have been dated back to the 2nd of August?
Yeah, we've gone very conservative with the new case in Richmond, and as the Premier mentioned, we're now seeing exposure sites again across our city. So again, if you're living in Richmond, we have active exposure sites in Richmond. As you know, we're always really conservative about the timing of our exposure sites, particularly when we're starting to see more community transmission than we'd like to see. So she did a test, I believe, on the 31st of July, from memory. That was a negative test. Based on her symptom onset, based on her own experience, based on her reporting back, we've taken her infectious period from the 2nd of August. We know, again, genomically, not connected to Miss Frankie's, we know there's a massive gap in terms of 3 weeks to 2.5 weeks between those exposure sites, so we're very comfortable with that.
How likely do you think it is that she is sort of that her case was an early one, and that she may be the source of the Glenroy cluster, or do you think
we don't think so. We think we've got stronger leads in the Glenroy West cluster than her. Again, you never exclude any possibility, Rachel, and as we see with some of it's a jigsaw. It's an active 3-dimensional jigsaw. Sometimes the pieces move around again, and you rethink your direction of flow. But at this point in time, we've got no reason to believe that she's the index case.
And one more on Glenroy. When that cluster, the Glenroy West Primary School cluster, first emerged, we also had another household in Glenroy, and you hadn't been able to link the two. Have you been able to?
Yes, that's right. So the second household in Glenroy, which was connected to a child who was at Corpus Christi School, we found in one of the cases we discovered, I think 2 days ago, was a missing link child, also associated with Glenroy West. The kids had played together on the footy park, and that's how that connection was made.
Just to be clear, with the mystery cases, all of them are genomically linked together. It's the physical where they've caught it from that we can't find.
That's right. So with the exception of the cases we're reporting today, so St Kilda East, some of those other cases, we haven't yet got the genomics for that. That'll come through in the next 24 hours or so. But again, the working assumption for us is what we're clearly seeing, with 8 subclusters, is unknown levels of community transmission that we've not yet been able to see. And that is the real concern for us at this point in time. And this is why it's a wider issue. So I think the view that people at home might have taken 4 or 5 days ago was, well, this is something about schools in West Melbourne, shopping centres in West Melbourne. That's not something that impacts on the rest of the city. We can clearly see change of transmission that are now popping up in different bits of geography, as I said, from Frankston to Dandenong, eastern suburbs, right through the heart of the city. So this is something we all need to be really, really alive to over the coming days.
And most of these...
Oh, sorry, behind you.
Sorry.
We've seen a pop-up testing clinic open up at 480 Lygon Street this morning.
Yep.
How concerned are you about a potential outbreak in the public housing towers there?
Look, I think one of the highlights of the last week has been a really strong collective community response to some of the risks in public housing towers. A lot of activity, particularly around Racecourse Road, and it's been really good to move those positive cases out into hotel quarantine, and that safeguarded the rest of that community. We continue to test very regularly in there. We're doing wastewater sampling at some of our individual public housing blocks, including 480 Lygon Street. That blipped as a positive about 2 days ago. We have therefore, yesterday we tested a known primary close contact in their household who lives in that building. They tested negative. We tested everybody on their floor. They're all negative. We tested about a quarter of the other residents in that block yesterday. The remainder will be tested today. Again, this is the targeting we're using with wastewater and the other intelligence we have. We want to really swarm around where we see potential risks with this with COVID and get on top of it very quickly. And the public housing response has been outstanding so far.
When these latest outbreaks emerged, there were two chains of transmission, essentially, the Hobsons Bay and the Maribyrnong. Have we been able to connect the two? And are all of these subclusters connected to Hobsons Bay, or are some of them connected to Maribyrnong?
So I think the other cluster, which was the Maribyrnong sort of a cluster, that hasn't gone anywhere else. It's stayed very static at 4 cases. Again, the family individuals concerned done a great job of isolating. And that's actually, it's a textbook study of what you want to see happen. You find a case, you lock it down, you lock the primary close contacts down, you go through those rings, and nothing else moves. You see no further seeding out. It's been a really, really good piece of work by that group. We don't have any links between them and Hobsons Bay. What we're seeing is the bulk of our cases, the bulk of those 185 cases are coming out of that Hobsons Bay Newport Coast cluster. But again, I don't yet have a clear link for Glenroy. I don't have a clear link for St Kilda East or Middle Park. Those 3 we've still got to put into the jigsaw somehow.
And I know this is a bit of a, you may never be able to tell, and there's probably an element of luck to it, but do we have a bit of an understanding of why the Maribyrnong cluster stayed static? You were able to essentially drive that down, and the Hobsons Bay cluster took off? Look,
it's a bit of both. So I mean, there is luck involved. I mean, it's about when you get into the cluster, and it's about how active those individuals have been, and how many contacts they've had, and how much viral load they have, and how easy it is for them to pass it on to others. The Maribyrnong case had very few workplace contacts. Remember, he worked at a warehouse in Derrimut. We tested on a negative. Most of his work is a little bit more remote from other people. That probably helped. The teacher we found worked very closely with a whole bunch of school children in a very big and busy school. Those children take it home to their families. It then jumps into other children, into other schools. So those transmission chains from Newport were just that much stronger. Similarly with an optician working in Caroline Springs, close contact with customers, and then it just jumps far more quickly. So some of it's luck, and some of it's just about the pattern of contacts that people have.
Has that Glenroy teacher been moved out of the Richmond apartment building?
Yes, I believe they have. That's right. Yeah. If they're a positive case, they've been moved out.
And just going back to that St Kilda apartment site, is it Tier 1? Are the residents there Tier 1?
At this point
it's got an email from Monash Health saying that they are.
Yeah, so at this point in time, so when Monash, our local public health team got in touch with them, so the Monash team got in touch with them late last night, contacted people initially. They've taken an initial judgment call to make it a Tier 1 site. The teams are on site this morning. They'll work with that building during the day. We'll do a full infection prevention control assessment. We'll look at ventilation flows in the building. We'll test everybody. We'll take a view based on those results.
And there'd been a serious uptick in the number of people booking for vaccinations at state-run clinics last week. Given AstraZeneca's been opened up to everyone at all state-run hubs, do you have numbers or? Yeah, so look, we've completed 150,000 vaccinations already this week. So we're on track for a record week this week, breaching our previous limit, depending on how well we go today. But I'm expecting strong numbers today. The Premier announced the 1 million drive a couple of days ago. We've made a good start on that in the last couple of days, and I'm expecting to see. Yeah, as we make more vaccine available, there is a real drive and hunger now for vaccination, and a big shout out to all those people who have really come forward in the last few days. I think we can all now see how precarious this position is that we're all in as a state. Getting vaccinated is a critically important part of getting ourselves out of this long term, and let's get the vaccination journey done. And how many bookings this week compared to last week?
Which I neglected to mention earlier. So we're very close to the marker of 2 million doses administered through our state-run centres. So we're now at 1,948,996. That was as of this morning. So hopefully with a couple of strong days we'll be past the 2 million mark, which is a very significant achievement. I can confirm that just in the few days, so in the 24 hours in fact following Friday's announcement, more than 68,000 Victorians booked in to get vaccinated at our state-run vaccination hubs, and we've seen at least a third of that has been for AstraZeneca appointments in that age group 18 to 39. So there's something like, if you look at it, over a 5-day period, the 9 sites that we had as a kind of trial, if you like, from the previous Sunday, we'd had 22,000 Victorians aged between 18 and 39 that had booked in those 5 days. So that's set to grow further now that it's available at all of our sites, and obviously there's a process to go through, but we're now close to 300,000 additional appointments over the next 5 weeks, and they'll be made up of a mixture of both Pfizer as well as AstraZeneca, and we recommend to everybody from 18 up, please make an appointment, please get along. There'll be a process to go through to make sure that your individual circumstances are taken into account, that you provide informed consent, you get a vaccine, and then you're in a much safer position, even off a first dose.
Can I just clarify, sorry. So in the 24 hours after the announcement on Friday, 68,000 bookings compared to about 23,000 bookings a few days before that?
Yeah, something like that. So my notes tell me that in the 24 hours following Friday's announcement, so when we announced this, 1 million, and the fact that AstraZeneca would be available at all of our clinics and that we'd add additional appointments, that was about 200,000, now it's 284, close to 300,000. We had something like 68,000 Victorians booking in to get vaccinated, so that is a big increase on what we would normally expect. So again, you know, I think that there's a lot of stuff written and said about people being hesitant. My experience is that there are many millions of Victorians who want to get the jab, and they want to get it really very, very quickly. They wish they already had it, in fact, and that's why we're doubling and redoubling and increasing our capacity, and that's why there are appointments available. And I would commend to anybody listening, watching, go online, make an appointment. You can book with certainty, and we'll get you the jab that you need.
The flip side of the coin, do we need to be feeling concerned about our testing numbers in the 33,000 mark yesterday? Yeah. Sorry, Friday, 32,000 yesterday. That's well short of the 40,000 you hoped for.
Yeah, look, we always hope for more rather than less. I would say that given we've got community transmission, given that this is out and about in the community, there's 8 of these sub-strains, you know, a couple of things. Let's not any of us make decisions that might contribute to a 9th strain or a cluster or a 10th or an 11th. Further mystery cases, further cases. So we've got to follow the rules, and part of that is that any symptoms, however mild, please go and get tested and do it as soon as possible. 98, 99% of results come back the following day. So if you were to get tested this arvo, we'll get your result tomorrow. Now you've got to stay away from people, but you know that's a small price to pay compared to you potentially spreading the virus. There isn't a lot of seasonal cold, flu around. So the assumption, the doctors tell me, the assumption has to be if you've got symptoms, you've got to assume you've got COVID. Get tested. Hopefully you don't. But in getting tested, you will have played your part in doing everything to contain this rather than making choices that potentially spread it. That's a really strong message to perhaps end on. If you've got symptoms right now, as you're watching and listening to this, if you've got symptoms, please go and get tested today. Arguably nothing is more important than that. If you are positive, the last thing you want to be doing is spreading this. You've got to go and get tested.
And sorry, you said last point, but your press release talks about
drive-through
vaccinations.
Sorry, Samaya. My press release says what?
Drive-through vaccination sites in Wyndham, Melbourne South East, and in the Hume Whittlesea area.
Yeah, there'll be three more, and we'll tell you about where they're going to be very, very soon. I'm not quite ready to tell you where they'll be yet because it hasn't quite been determined. But one in the southeast, one in the north, and one in the west, on top of the one that's at Melton at the former Bunnings site. And we'll get you some further updates tomorrow, probably about how many people have been through that. It's been very busy, and it just makes sense. I think it's the only one in the country. You come along, you make an appointment, you turn up, you get one down the window, get the jab, go and wait like you're waiting at Macca's or some other fast food place for a few minutes, 15 minutes, and then if you're fine, you're able to drive off.
And both AZ and Pfizer?
I believe so, yeah.
Andrew, just very quickly.
And there will be three more of those.
And 3 more at
three
the new
more.
sites.
There'll be 3 additional, and
AZ
we will.
and Pfizer be available.
I believe so.
for
Yes,
additional
it doesn't.
sites, yeah.
It's both, and we will announce where those 3 will be as soon as we possibly can. Hopefully, as soon as tomorrow. One more for Jerome.
Yes, sorry.
No, it's fine. No worries. Go, Jerome.
Just with this St Kilda, these 2 cases, again, are we looking into, is there a potential religious gathering that's been breached here, or we're hearing reports of like Airbnb parties that are happening in that area
I'm not
as well?
aware of Airbnb parties, but we're certainly exploring all possible information. As you said, these cases dropped yesterday afternoon. We've had some very, very, very positive and very encouraging conversations with community leaders last night and again this morning. There's a lot of information to work through. I know the community is working very hard. They're very concerned, keen to understand what the exposure might have been, and they want to make sure people get tested. And if I could just say, I think our long and hard experience of this has been that where communities work together, where community leadership really steps forward and takes on its responsibility to engage and to communicate and to support, we'll get a really good and swift result, and we're confident of getting that in this one.
The nature of any other cases that have come up today, the 25 that we're talking about, is there any concerns raised there aside from potentially those 2 where people haven't been following the rules, things have been spread because people haven't been?
No, look, I think it's a game of 2 halves. Really. I mean, we've got the bulk of the cases that we've reported today are cases that we've known about that are already in isolation, already part of that controlled system. So the contacts around Altaqua, around Caroline Springs Square, even around Glenroe West, they're all people we've known about. Some of them started isolating after their potential infectious period, but at least they're part of our controlled system and they're doing the right things. The mystery cases today are always a concern. So we'll have lots of conversations with them to be held today and over the coming days to establish their movements, what they've been doing, so we can find everybody who's been part of their exposure.
And have all the cases been forthcoming with contact tracing?
Yeah, no, they have. But I think again, we try to create an environment of confidence and trust for anybody who's got COVID, anybody who potentially has to be contacted by a contact tracer. The information you share only goes to us to try and deal with our public health response to make sure we can protect people who might have been exposed to you. Nothing more, nothing less. Okay, good.
And just finally, I'll just say to Jerome's point, there have been people throughout this pandemic who have made choices thinking, oh, well, I'll be fine to go over there, to go to someone's house, to go and do something that's against the rules. They never thought that they'd finish up positive. Turned out they did. Hundreds and hundreds of them, maybe even more than that, have finished up positive. They've been spreading this virus unbeknownst to them with this false sense of confidence that the rules didn't apply to them. The virus applies to them, the rules apply to them. It applies to all of us. Let's all of us do the right thing and not contribute to the spread of this virus. I want to thank the millions of Melburnians and Victorians who are doing the right thing. I want to appeal to those who aren't. From today, let's all make better choices to drive these numbers down rather than contributing to them going up. Please get tested if you've got any symptoms, and please book with confidence those almost 300,000 additional vaccine appointments over the next 5 weeks, so we can get 1 million doses into 1 million arms for 1 million reasons, but most importantly, so we can keep everyone safe. Thanks very much.